I'm your host, Carnisha, and I'm back again with a new episode. So, without further ado, let me bring on my special guest for this episode, Dr. Yolanda Carroll. Welcome.
Hey, everybody. Hello.
Hey, welcome. Thank you for coming on. Thank you for agreeing to join me for this episode. This is a very special episode. Because I feel like, as you know, on this podcast, we discuss things that are definitely life issues, things that we deal with in our day to day lives, but also maybe with a tinge of the church, how we experienced it in the church. Because I grew up in the church, a lot of my framework is from things that we experienced and growing up in the church. So this is where we are in this episode 4. And this is titled Mental Illness and Relationships. And for those of you that don't recognize the name, Dr. Yolanda Carroll, this is my mom. This is my birth mother. She has known me since the moment I arrived on May 4th, 1982. And really excited for her insight and feedback on this particular topic. So again, welcome. Thank you so much for joining us. And I really hope that we'll be able to dive into some good conversation, some transparent conversation on your experience with mental illness and your experience as a leader, as a pastor, as a wife, as a mother, all of those things. And we'll just jump right on in. If you want to say hi. And also, before we get started, can you just fill me in or fill everybody in on what are your thoughts on 2020? I mean, we're here in the last couple of hours, but child, what are your thoughts?
You said in your notes as we were speaking, you said, what describe 2020 in one word. My first thought was cuss word.
Correct.
Yeah.
Agree.
So 2020 was definitely a cuss word.
Man.
But I thought about it. I said, okay, let me be serious. So when I think of it, I think of the one word is experience. And so I say that I've experienced some feelings I've never want to ever feel again, including hurt feelings, including feelings of loss. My dad passed away in April.
Yeah.
I'm just brokenhearted about that. But then some experiences that really are shaping, that shape me for what's to come. And then some great things. My little Ollie kids, I've got a new grandbaby that was born right around the time my daddy passed away. So all of my grandchildren are dear to me, but there's a certain endearment for that. But 2020, first word was cuss word. And the second was
I'm not mad at it at all.
Experience. So.
I'm not mad at all. So how did you make it through the holidays? I know everything was kind of different with the quarantine and pandemic and all of this. So how was the holiday, Christmas, Thanksgiving? How did that shape up for you? Cuss word again.
Word again. However, again, with the reason why we had to do it the way we did it, I have to, not be such a titty baby about it, and be adult about it. But I adore my family, and even for since early spring, just even like getting a chance to see my mom and my children, and I say that I'm an introvert that has learned to live as an extrovert. And I think I want to embrace that real good. Once we get off punishment, I'm gonna let people hug me more.
I know that's right. And the jury's still out on that introvert stuff. I don't know about that, Mom.
Yeah, really. I am an introvert that has learned to live as an extrovert. And you've read a lot of stuff about that, Carnisha. Introverts get their energy from being up by themselves and reading and music and that.
That's
true. When they go out into the world, they can show up big.
Right. No, that is true. That is true. So for those who don't know you, like I said, you are my mom. My parents have been married for 41 years.
41 years will be. 2021 is here, so give me my 42. I'm
Oh, come
6 months
on.
42. So go ahead
Okay,
and
so
Google.
give us a brief intro. Who are you? Where are you from? Like, what do you do? What's your thing?
I am Yolanda Ford Carroll. I'm Marjorie Ford's daughter. I am married to the man of my dreams, my sweetheart, my high school sweetheart, Cornelius, and we've grown together. So, many people they ask about, well, how do you do it? How do you do that marriage thing? But we were, you know, uh, riding in, going to what was it, Prince's Hamburger when we were 16 and 17, and
Yes.
he let me eat and say he wasn't hungry because he only had, just a certain amount of money from his part-time job at the moving company.
Come on, get her
Yeah.
something.
So he got me a shrimp basket from Princess Hamburger. He said, "Oh no, I don't care for anything. I don't like
Oh,
anything."
I love that.
Many years later, we realized because you only had $7 and you got to
I
put
love it.
$2 worth of gas and buy me the shrimp basket. But I am a mom to three amazing young adults. My Carnisha, my firstborn, and her family. I have a son-in-law and 5 grandchildren, blended grandchildren, and then my my younger daughter, Shannon. That's my 2-bit change, as they say.
Baby.
That one right there. And she's married to an amazing husband, Sean. And then my youngest, he's Deontez. He's 21
Mm-hmm.
and trying to figure out what he want to be when he grow up. But
Boom.
he's amazing too. He's amazing too. And then I'm a parent of a third girl, Pepper. Love my pepper snack. And why right now as we're speaking, excuse me, but I have to get
What
this
is she
gum.
eating?
Gotten a piece of gum from somewhere. Get this from Pepper.
Oh, goodness.
Yeah.
Okay.
But yeah, she's a 2-year-old little puppy. But what do? I am 63 years young and
Yes.
fabulous. And I spent a lot of my working career. I grew up in Houston, Third Ward, native, some kind of ghetto, some kind of bougie, some kind of church girl. So yeah, I'm the oldest of 5. I was a born leader. The oldest of my siblings, and you know how history shows you that whatever. If you look back when you were younger or little, you can kind of see the pattern of what you're going to do and who you're
Oh,
going to be.
yes.
And so, being the oldest, whenever we did music or played the Jackson Fives, I was always Michael. And when we played school, I was always the teacher.
Okay.
So, yeah.
I see where you're going.
I'm that one. And went to school with Texas Southern, and then went on to Bible college and done some things and made some good choices and some not good choices. But most recently, I completed my doctoral degree in theology, which
Yes.
is pretty cool.
Cheers.
Yes, jazz hands. And then the other piece I think I want to throw in because it is important to who I am. I am my husband. I'm a pastor's wife, of course, but I am. God is healing me even right now. That's why this topic is so dear to me. God is healing me of depression, anxiety, and bipolar disease. And so, as I walk that thing out, I was diagnosed probably about 18 years ago. However,
Wow.
I think that was a challenge, a clinical, and it's a clinical imbalance. So when you think of depression and anxiety, you're like, okay, that's not necessarily somebody that's crying all the time, or it's
Right.
not necessarily someone that looks sad all the time. Oh, she must be depressed because she looks sad all the time. But it is
Right.
a chemical imbalance where your body does not produce all the endorphins that create those happy feelings. And then anxiety piece, and certainly there are times that you are sad or you cry and you don't know why, or you easily agitated. but however, there are also so many other facets to that. But anxiety, when anxiety, literally anxiety, anxious about driving, or anxious about what if what if something happens? What if,
Mhm.
especially now with the pandemic and everything, what if this, like we went on a trip this weekend, a short trip to do a wedding, and we valeted our car a lot, and
Mm.
so like, they've been in and out of my car a lot,
Yeah.
and they
Yeah.
my my steering wheel, and they touched my key,
Yeah.
and sat in my seat, and so you anxious about uh, the uncontrollables. And so that creates a whole lot of energy, negative energy. And then the bipolar piece, people get really anxious or almost afraid of you when you share your diagnosis with bipolar disorder. And there are a lot of different kinds, but mine consists of just really high highs and really low lows. When,
Mm.
high highs, I'm just all over the place. And probably my daughter Shannon will say last night I probably was bipolar crazy because we were at a wedding, and I love taking pictures, and I love uh, the the accolades and the excitement that the people get when they see that I took
A great
them
picture.
a great photo or something that certainly the photographer wouldn't think to or that
Yeah.
special and stuff. So I was all over the place last night. So Shannon probably gonna say, yeah, she again, high highs and low lows. And so that uh, um, sometimes allows or creates an environment where I just want to stay in the bed. I don't want to get up.
Okay.
I don't want to drink. I just don't want to. And it's not necessarily that something happened. Now, with some people, um, depression, anxiety are situational, that something happened,
Okay.
a death of a person, a loss of employment, your livelihood for,
Mhm.
38 years, or even
Yeah.
a relationship that failed. Somebody died. May feel like somebody died. So there are situational depression and anxiety, and then there are those that are clinical imbalances that we really need the medical intervention to help with. And
Okay.
even that, as African Americans, we are, we really closed mouth about sharing depression. Now, non-African Americans have always said, I have a therapist, or I got to go to my therapist, or I need to get my
Right.
prescription fixed. Some even would check themselves into facilities. You hear non-African Americans saying they went somewhere and got some tools to manage that type of thing.
Wow.
So it's very interesting to live with those disorders, but you kind of work with it, work around it, and sometimes you do extremely well, and other times you don't.
Okay. Okay. This is some great information. So when you mentioned about 18 years ago, you got a diagnosis
Mhm.
with depression and anxiety. So kind of walk me through what made you go to the doctor, or how did you even know that there was something to be addressed or looked at, or what was the process in you being able to get a diagnosis?
Actually, several things, and the most significant ones were y'all, my husband,
Yeah.
you, and mostly my husband and you noticing, okay, something's wrong. Why did that upset you that way? Why are you that agitated? Or why are you, in the bed? You won't get up. You won't eat. You won't drink. You won't.
Mhm.
And even you can think back even earlier than that, even when we lived in another state,
Yeah.
and you guys were down here in Houston, and we were there, and you came home, and I'm all looped up, and I got a neck brace on, and I got
I bet
all of
that neck brace was, I mean, could we have gotten a warning on that? Because honestly, as a child, like you said, that was 18 years ago. So that was very just number one, kind of taboo, like what's wrong
Oh,
with her neck? And then
oh,
to, later we found out a pinched nerve as a result of, some other
mhm,
things, but it was, and that actually leads me into my next kind of thought and question. It kind of leads to, there's this stigma
oh, yeah.
among, we'll say Black people, because we already addressed the, white people have been saying for years, oh, I got to
Oh,
go to my therapist. And I'm sure you working in corporate America were around people and they were like, oh, I got to see my therapist,
absolutely.
2 times a week or twice a month or whatever the case may be. And I really, um, you know, thankfully to my parents, I had an early experience with therapy. And I
Mhm,
would say that's probably why maybe me
mhm,
and then my generation came on a little later. That I mean, they fully got on board. But talk
mhm.
about your generation and even the reluctancy towards therapy, or the reluctancy, or the even the stigma about
Oh,
mental illness. What is this? This isn't real. This is, just a,
absolutely.
moody or whatever. Talk about some of the things that you experienced early on with your diagnosis, maybe family, friends, or, what happened, as you
Mhm.
kind of started to walk in your diagnosis.
Absolutely. It was, it's very telling once you start to share. I tell my children, I tell everybody who knows me, if you know me, you will have heard me say, people can't hurt you with the information you tell them. And
Baby.
so early on, I have always shared my disorder or my concerns.
Mhm.
However, it was not popular even 25 years ago amongst Black people. And again, as you said, I worked in corporate America, and I had a lot of high income clients, and they made their therapy and their prescriptions a line item, and said
Wow.
we're gonna, we take care of ourselves. Our mental health is part of our budget. It's part of our line item. With African Americans, two ways it would go. We would either say, oh, she just needs to drink some water, or she just needs to, take some vitamins, or you
Pray
know,
about it.
yeah, pray about it. Ask God about it. However, and then even in my parents' generation, it was even, people in my generation would at least say out loud, oh yeah, something wrong with her, but just Black people don't, white people are saying they depressed. We don't say that. We don't.
Mm.
And so, but we've always had mental illness in the African American families, and even in my family personally. You wonder if it's hereditary, and I think there is some validity to that. I also think that there is uh, copying behavior that uh,
Mm.
I saw my mom act this way, or because I saw my dad act this way. I think some of the behavior is that's how you act when you're sad. That's how you act
Okay.
when you're mad. But back to your question, how has that affected me? In my day to day living. Me being a public speaker, a pastor's wife, a leader, a woman of influence. I have been uninvited to things. I have been, you share your
Wait,
story.
wait, wait.
Oh no, yes, I have had engagements in place that say I'm going to speak at this date at this time. And I've gotten a call or phone call and say, literally, no, email based on, on your current condition. Don't you think it would be
Come on,
healthier
come on, come
for
on, come
everybody
on.
involved to, uh, we do this, we look at you again next year for this or that. So yes, I've had definitely. And
Wait, but so
from
put a pin right there. So does that further maybe throw you into a, a moment where you may not be feeling your best? Does that put you into a even lower low, or are there triggers and things that you feel like people are judging you? So now the judgment kind of throws me into feeling worse about what, I'm fighting and healing, being healed from.
Well, sometimes yes, but however, most of the time it's just more of a hurt feeling or a disappointment because most of the time these are people that I do know. I've never had that happen with someone that, say found me on LinkedIn or somebody
Yeah.
referred me to someone else. But these
Wow.
where that has happened. So it's more hurt my feelings and everything. But we didn't talk about that much yet. But through medical intervention, that's how I'm being healed. So I take medicine for each one of those disorders every day.
Wait. So let's just park right here. So this is important. I'm glad you said this. So in the beginning, you says the Lord is healing me even now.
Mm-hmm.
And my mental health is improving. But right now, you just said you're being healed through medical intervention and you
Absolutely.
take medicine for each disorder daily.
Yep, that's correct. Every day.
Wow. Okay.
And
So this is important. This is important. So um your symptoms are being managed
yes,
through medical intervention.
absolutely, absolutely. And and that's okay. And even my
Absolutely.
couple of years ago, I told, I think you were here too. I told you and your dad, I was like, I'm not gonna stop. I'm just not gonna take all this medicine.
Yeah.
It's gonna heal me. God is gonna help me. I can pray for other people, and everybody does well except me. So in the name of Jesus, I'm gonna throw all of this medicine away. So I proceeded to,
Mm-hmm.
in wherever, and about it took maybe about 8 days, and I just hit a wall. And I
Yeah.
went to the doctor and I told her what I had done, and she is a woman of faith also, but she also says, listen to I said, well, I love God, and and she said, well, I love God too, and He gives me instructions on how to help my patients. But
Baby.
one of the other things too that I learned in this journey again, that she says, I'm not adding anything. She said, I'm not adding anything to you that you already have. What we're doing is replacing the endorphins that you don't have. And so
Mm,
just we don't frown on taking vitamin D or to get more energy. We don't frown on
that.
taking vitamin C to build up your immune system, or uh, taking fish oil to you know.
Wow.
So the same kind of, when you start to think about it that way, the fish oil and vitamin C and vitamin D and vitamin E, all of those things help our body to function like it's supposed
Wow.
to function. And so once you start thinking about it that way, that it's helpful. But because it's been so taboo, especially in our families, because we all have that cousin Toby that lives with us. We keep her in the room back there, don't let her come out. We fix her food, put it on a tray, take it to her, and go back and get it. And cousin Toby stay right there in that room. Same thing with in the church. And this is one of the things that I think, one of the things you mentioned in the church, we don't talk about that. And we don't talk about it for several reasons. And one of the reasons, I think, that we don't want
Hmm.
uh, people to not come to our church because the pastor wife crazy, or you don't want to be associated with crazy. That word, when you think of
Yeah.
anxiety, depression, uh, especially bipolar, you think
Bipolar.
crazy real good. And then the other thing is, there is a preconceived notion about how people with depression look. And one of the things with
Yeah.
me, I or what the people have. Well, why would they be depressed? Because she has this amazing husband, and got the house in the corner, and the dog, and the fish, and the white picket fence, and her car and her wigs have a name. Well, and
What she got to be depressed about?
the sophisticated skirt.
Wow.
But it wasn't my car and my house and my shoes and my purse that I almost lost. It was my mind that I
Yeah.
almost
Yeah.
lost. And again, I'm a very smart woman, but also in this journey, and you and my husband and my other children walked through this. But I made a very poor decision about my health. It's been, oh my goodness, about 10 years ago now. But I wasn't feeling good, and it wasn't. I didn't say to myself, I want to die. What I said to myself is, I don't want to feel like this anymore. So,
Mm.
knowing what I was doing, I took prescription cough medicine because I said, prescription cough medicine makes you go to sleep, and I'll go to sleep, and whatever happens, happens.
Okay.
So
Okay.
I took that, and it didn't knock me out, for lack of a better word. So I chose to take more medicine, and this was sleep medicine. And so I took cough syrup, prescription cough syrup, and I didn't have a cold, and I took sleep medicine. So when my husband came home, he found, came in, and I was all in a lot of times I'm in the bed, or, different things, and he found I was all looped up, and he was like, "What?" He says, "That's not wine, and that's not,
Mm-hmm.
what's going on?" And he said, "Did you take something?" And I told him, "Yeah." And he said, "What'd you take?" And then I didn't. I don't think I said, but the bottle and
Yeah.
the prescription medicine, was there. And so he was like, "Oh no, Yolanda, we got to go to the hospital." So we went to the hospital, and he told them, what was happening, and so they start to give me this horrible tasting stuff, like tastes like soot or something. But anyway, to kind of absorb the extra,
Mm-hmm.
and then they asked me, then a therapist or somebody important came in and said, "Well, Ms. Carroll, what did you take?" And by that time, I was sobering up some because it had been 6 or 7 hours, and they give me an IV fluids, push the thing out. And she said, "Ms. Carroll, what did you take?" And I told, I took uh, cough syrup, and then what else you take? I took sleeping pills, and then she said, "Did you know you took them?" I said, "Yes." She said, "Did you know you were taking them incorrectly?" I said, "Yes." And she said, "Well, would you like some help with that, with your decision making or feeling better or what?" I can't remember exactly. And I said, "Yes." So they politely loaded me in an ambulance and took me from Clear Lake Hospital to West Stokes Hospital. And if you're those viewing or listening here, if you're from here in Houston, Texas, uh, West Oaks Hospital is a psychiatric hospital. And so, and one of the things I've learned too, that I didn't know then, is that you can check yourself into a psychiatric hospital, but you can't check yourself out. And
Wow.
so once I got in there, and they, they filled my prescriptions and everything. And, they start you in a routine trying to, you get to stay here, and you're going to go to therapy, and you're going to get yourself together. Well, also because it was considered a suicide attempt, I was put in an area with people who are depressed and bipolar stuff, but the ones who like be hiding behind garbage cans and stuff, and
Uh-oh.
those who are who are seeing that how the people,
Hallucinations and stuff.
yeah, are the people that voices are telling them that
Oh,
you know
okay.
the world is coming to an end, and I'm like, I don't belong. And so after a couple of days, and they had my medicine, and it was in my system real good, I wanted to go. I wanted to get out, but they said no, that because a doctor that doesn't even know you evaluates you.
Mm.
And so, one of the things that happen when you're in a psychiatric ward, they don't let you have a brush because they say you're gonna the bristles you could hurt yourself with. They don't let you wear a bra because the underwire. They said you could harm yourself with that. You don't have a one sheet, so you can't tie it up around your head. You can't have a pillow at
Oh,
all,
Lord.
and you can't get any flowers or anything because you might hurt yourself with the vase or the whatever. I don't know. I guess they think you'll eat the flowers. I'm not
Oh,
sure what.
wow.
that with me, they didn't let me eat with the regular people, and they only gave you food that did not have like seeds or
what? I'm just hearing some of this. This is what?
So, boiled eggs, cereal, or oatmeal, or just things that you could not, food that don't, no apples, nothing with seeds that you could possibly, choke yourself with. And so it went on and on. I was actually in there about 5 days, and there was a Christian nurse in there. And about the third day, and I was, my husband could come see me for about 30 minutes each day. And then we couldn't use telephone, regular phone. And they had a pay phone that people could call you on. And so they would, you could call on the payphone. Well, my sister, my god sister Kathy, was calling, trying to check and see, and then the nurses, she kept saying, "I want to talk to her. I want to talk to her." And the nurse says she can't take calls, right now. And Kathy kept calling. She says, "You're not gonna get no rest. You're not gonna get to do your job tonight if you don't let me talk to her, because I'm gonna keep calling back every 15 minutes." For 9 hours. So they came and got me and took me to the payphone and let me talk. And Kathy called, and I was like, "Kathy, they won't let me out, and they won't." And she was like, "Okay, we're gonna pray," but she let me have it too about, hey, that was the wrong thing to do. You weren't right for that. So that's something too, that you want to surround yourself with people that love you but don't support your foolishness. And so that's also helpful. Also, but my husband, on the other hand, two things I think was humorous. When I was talking to him, I said, "Babe, I was crying." Uh-oh, what just happened? What just happened, Carnisha?
You lost me?
I did.
I still hear you. Oh, there you are.
It just
There you are.
It just went bananas. But when I called my husband, I was talking about when one of the things that happened when I was in the facility in West Oaks Psychiatric Hospital is my husband, I was calling him and crying on the phone because I said, "Oh, can you please come get me out of here, please? They want me to wear paper pajamas. I'm just not gonna wear paper pajamas." And so my husband, even though that was, it was serious, but he said, "I just kind of felt a bit of relief when you said that." I said, "She in there."
Yeah, she good.
She good. She inside. Everything, the spark plugs are connecting again, because
Right.
she thinking about fashion. She don't want.
Right.
She want. So, but the long and short of it is that was a very telling experience for me, but also it did a lot of things. It made me know that I won't ever do that again. But also that you, like I said, you can check yourself in, you can't check yourself out. But there was a Christian nurse there, and after I started to come to myself, and they were able to, I could read. I love to read, so they gave me a couple of books, and then I started sitting there, kind of talking with other people about the book, and then the nurse said, "You know what? You don't belong here." And I was like, "I don't belong here." And she said, "So look, we're going to pray. And also I need you to act like you don't belong here. So go put your clothes back on." She washed my clothes. Let me put my clothes back on, take off those paper pajamas, because that was making me depressed anyway.
Right.
And I started doing just a little small group in the psychiatric hospital. And so
come on,
doing that, I was like, they ought to let me go now. But this one doctor that came through like every day to do rounds, he just asked a couple of questions and make a determination, not yet, or this and that. And so on the fifth day, I told him, I said, I want to get out. I'm going to check myself out. He said, against, they told me I could sign myself out, somebody else, the nurse and one of the patients in there. But so I said I was going to do it. They gave me the paperwork, and then he called me in, and he said, "You're not ready. You're not ready." And he made me a ward of the state. He signed off on papers that said she cannot make good decisions for herself. So I'm making a medical determination. And I don't know if you remember all the details about it, because you were married and, you weren't actively involved in that whole process and getting in and out. But we even had two doctors from at our church that said we can sign her out in our state into our care. They wouldn't do that either. So, but the nurse kept telling me, okay, still do the right thing, just keep doing the right thing. We're going to keep praying and stuff. And so my husband was coming up there every day, feeling, trying to get me out. And finally, someone at his job told him, said, tell him you're going to stop the insurance. And so Carnisha came up that day with his briefcase and his clothes and dress.
Come on, briefcase.
And said, I want my wife out of here. And you're charging me and my insurance for this every day, right? And and he said, effective today, I'm going to give my insurance notification not to continue to pay for that. About 4 hours later, honey, I was coming through them gates, girl. They was unlocking gates, unlocking them doors. And it was the same, once he told the facility, we're not going to pay for it, they let me out within 4 hours.
Wow, though.
So it's a whole lot that goes along with mental illnesses. Now, that particular instance did send me to a place that, but it was more so I was disappointed in myself, because even with the poor choices and stuff, in your knower, the common sense part of you is like, this is not the right thing. And so, and don't do that. What if it don't work? And then you've taken this, you've caused yourself to have a stroke, and then you don't die. And so now you're dragging your arm and your foot and your lip is, turned.
Wow.
It's a challenge. Again, my for the most part, my illness is managed through medication. However, I do need to do the things that regular people do, like proper diet and exercise, proper,
getting some sunshine.
Yeah. Yes. Getting some sunshine, and be careful about the cool, refreshing beverages, because
yes,
those kinds of things, are in, even a lot of caffeine. Those affect your moods and things like that. And then the other pieces, I try to exercise. Like I said, I love to read, so it's always helpful for me to read something inspirational, or read something fun, articles, those kinds of things. Even listen to music that helps, and then positive self-talk. You have to say to yourself, the Word of God tells us to take those thoughts captive. And so when the negative energy, the negative thoughts come in, we have to literally work hard to, try to take those thoughts captive, replace those negative thoughts with positive thoughts. And even with 2020, it has been a booger, but I still believe in my belly that everything happens for an intended purpose. So even in the scriptures, I can't think of the when in Samuel, in First Samuel when, the people wanted a king and all of this stuff. And, sometimes our environment will change, for a movement to occur. So,
Mm-hmm, mm-hmm.
And with the pandemic and all of that, sometimes there are things that we just would not have done had this not happened.
Absolutely.
And, so those are my thoughts.
That's good. That's good. So let me ask you this, and we're coming around the bend. So what do you feel has been the shift as far as attention to mental health? So since you were diagnosed, like back then, like it was kind of maybe still a little bit taboo.
Mm-hmm.
How do you embrace the shift? Like, there's a whole mental health month and all of these different things. How do you feel that the shift, and is it beneficial? The attention brought to it, do you feel that it's helpful, or is it, just a lot of hoopla? What do you think?
I totally believe it's helpful. Absolutely. And I think just as you mentioned, the shift is because of awareness.
Yeah.
Somebody decided to let's champion this. This is just as serious as uh, any other disease or disorder. And um, once we, the there was more exposure, or we were exposed to more information, and then people like medical professionals decided that they would get, more knowledgeable, get more, offer services, those types of services.
Right.
And then again, in the Black community, um, we are. Those of us who are into this empowerment, purpose, we start looking at, okay, what all can I do to be my best self? And some of that includes, emotional well-being. And so we've started to seek that out. And then there are other people, influencers. We have the social media influencers that are saying, help you be your best self. You have a purpose, and those types
Yeah.
of things. And so a lot of the shifting has come because somebody told us we can help you. Somebody told us this may be what your challenge is, because many times we think, okay, well, I'm just stressed. Just
Well, and
stressed.
that's a good point. I know that as you mentioned earlier, my baby is 8 months old,
Mhm,
and every time I've gone to my doctor
mhm,
as well as her doctor,
mhm,
since she's still under a year,
mhm,
um, I have to fill out a questionnaire along with like the regular health form
mhm.
to, address postpartum depression.
Absolutely.
And I've been very, very impressed and very pleased with the attention that it, is given, because a lot of times, I know it's kind of separate, but it does fall into the mental health category that, when you have another baby and when you have a baby and just all of the changes that your body goes through, and just, I mean, I can just imagine, and I can't remember what the stats were, but I mean, alarmingly high of how many mothers really fall into postpartum depression and don't know it. And I think one of the last times I went, they said I was, kind of like teetering on the line,
Mhm,
but thankfully, my husband has been kind of like just very vigilant, and my family has been keeping their eye on me. But, just in the midst of having a new child, being quarantined, being
mhm,
in the middle of the pandemic, like you can't even go to the corner store without worrying about coronavirus. And so I can just imagine when you're already documented and diagnosed and just daily trying to live out, you know,
mhm,
you live out your best self when
mhm,
you can have multiple barriers giving you anxiety and things
mhm,
to feel anxious about. So I really appreciate the attention that's been, it's on, you see it on TV, you see
mhm,
all kind of medications being advertised, you see, even appreciate at the church, I believe it was during mental health month,
mhm,
that we had a whole presentation for each Sunday during the month, and just really put some attention towards like taking care of your mental health. And so I really appreciate, the attention that's put towards it. So that's a excellent thing. So let me, as we finish up, let me just ask you, as a person who has a little bit of experience, what should a person do if they feel that, this is a two-part question. What should a person do if they feel that they are kind of, just mental fog? Like, what are some of the symptoms of maybe depression? Just give us some symptoms that they might say, you know what, I might need to get checked. And then the second part of the question is, how can those family members close to, if you have a loved one that's dealing with mental illness or some type of mental health issue, what can the family members do? So I know that's a loaded question, but two things. What are some symptoms that you can look for or family members can look for? And then what can family members do to support those who are actively, fighting mental illness?
Okay, well, with the first question about what are some symptoms, some of the symptoms of depression, people don't recognize it as that. And one of the ones that comes to mind immediately is that person losing interest in things that they normally would like to do. So,
Okay.
like for me in particular, I'd love to go out to eat and have the people put the nice napkin in my lap and bring me the water, the bottled water,
Okay.
pretty. Also, and certainly mood changes. Either again, uh, easily agitated, or extremely, high. Yes, again, extreme highs and extreme lows. If you notice that the moods are just almost unpredictable. Like, is she going to be
Okay.
really? She going to sleep in the bed all day today, or is she going to go out to the mall and spend $450 on greeting cards?
Gotcha.
And so people doing things that they don't normally do, and then also people doing things to feel better. You notice e- excessive drinking or excessive eating of a particular thing. They just eat popcorn most times, just
Gotcha. Okay.
more than their regular food. And then again, not caring about their physical appearance and stuff. I don't have to. I don't want to comb my hair. I don't want to.
Okay.
I don't want to. I don't want to. I just want to wear flip flops outside to church.
Okay. Gotcha. Gotcha.
And those types of things, and even not caring for your personal. If you have a house full of plants and they normally, you water your plants and you uh, brush your dog, and or someone that's a house cleaner, like one of my friends, Judy. She cleans her house all the time. Dust and vacuum and sweep every day. People
Mhm.
doing things that you like. Why didn't you know?
Okay. Okay.
So those are a few things, and then the other thing, what can you asked about? What can family members and things do? Again, keep once you notice those types of things and see what we're doing. Like you said, you've been going when you go to your doctor for your regular checkups. Then there's a questionnaire there that's in place too. And it's going to be our responsibility or my responsibility to share the information that the doctor is giving me. But
Right.
so with me, and you guys, and even some of my closer friends, when they literally they made the appointment and said, okay, we want you to see somebody and we want you to see somebody. And even with my husband, I even as resistant where I was, it made, I acted mad about it,
Right.
made statements like, well, if somebody told me to leave them alone, I would leave them alone.
Okay.
However, he's like, okay, I will leave you alone, but you get in this car,
All that, but you still going.
you, you, you're still going. So sometimes, you have to be, and you guys, y'all,
Oh yeah, baby. I love to come in and open the blinds and
come in, open up,
throw the
go to
throw the curtains open.
lights on, all of those things. And even if it gets to be, I'll say this because I know you're trying to finish up. If it gets to be serious, as very serious, uh, y'all did intervention. Y'all remember y'all had my sister to come down here and said, let's just
Yeah.
trap her in this bathroom and see, can we get something together?
Yeah.
So, and those were, I mean, and everybody's not going to be as resistant as I was or am, but uh, for those listening, I would, again, and at the risk of sounding religious, we're gonna have to be a praying group of people about our,
Absolutely. Absolutely.
even with the church, with the church not being, we're not being able to be open and be there and speak to the community now, because again, actually the people who are, all of us being home, being not being able to get out. Some of us, I was teasing someone, we're talking about COVID-19. I said, I have COVID-19, those 19 pounds that
Right.
found. There are a lot of people who could use some encouragement from the church, from the people of
Yeah.
God, the people that, and so when we do get back, when we'll have to have some real candid conversation. That's one of the reason I'm excited about you doing this, because even this will be beneficial to those who are at home, who
Yeah.
can hear this, know that you're not in it by yourself, and you're not alone, and it doesn't have to be a death sentence. And
Yes.
so that's something that I would like to encourage people. And then the other thing is, there, even with these kinds of um, avenues and resources, the podcasts and the videos and those types of things. This will help somebody real good. So if you
Oh
hear
yeah.
someone,
Absolutely.
know someone, hey, tell them, hey, listen to this. And again, this is somebody that, when I walk in the room, I don't look, depression doesn't,
Look like, yeah.
it doesn't look like. So that's one of the things too. We want to kind of get away from just making us an assumption that she's all right because she look all right.
Mm, say that again.
Yeah, that.
We want to stop making the assumption that she's all right because she looks all right.
Yeah,
'Cause I remember y'all always said like, I clean up well now. Don't,
I
because
do.
I'm gonna show up for the picture. I'm gonna show up for the video or whatever we are doing. But I appreciate you bringing light to it, because again, like you said, just because I look all right don't mean I am all right. But that daily process, that daily journey, just really grateful that you shared transparently your story. And I do know that it's going to help some people. And just as your daughter, I want to bring some attention to the fact that, yeah, she has had some moments
Mm-hmm.
where she really struggled. But look, you're a life coach. You're coaching
Yeah.
women daily. I mean, I'm her personal assistant, so daily it's like, okay, how many appointments do you have today, and what seminar are you hopping on this time, and all of these Zoom calls and different things. So continuing to pour out and speak from your experiences. So you did hit a wall at some point, but you don't have to stay there. And so I appreciate just the journey, just the process, and sharing that. So, as we finish up, I have this segment that I like to do on every podcast, and it's called Rooting for Everybody Black. And I don't know if you saw this, but a couple years back, Issa Rae, they were asking her, like, who are you cheering for? Who are you hoping will win at this particular award ceremony? And she said, oh, I'm rooting for everybody Black. So just if you Black, I want you to win. And so that's just kind of something that I've wanted to do. And so I want to formally salute you, especially this year. You know, the just Corona alone has been a doozy for everybody, but experiencing loss, many people don't know that your primary kind of administrative and caretaker for was both of my grandparents, but now just my grandmother since my grandfather passed, and just all of that. And in the midst of that, still being able to process and complete your doctorate, just an awesome accomplishment. And so just giving you some kudos for this, some claps and some jazz hands, and really excited about what's going to continue to come forward and come up even in the next couple of months. So we're excited, we're proud of you, and so glad you dropped on. Know you had quite a few things to juggle, and I appreciate you making the time to jump on.